kind of felt like we owed you all a little bit of a longer update than we've been giving you, just little pieces here and there. So we wanted to make a quick video, right?
Hi, Hope will talk. I have no energy.
He speaks volumes with his smiles and his eyes, so that is where he will be communicating, and it'll be all my voice. So we feel like maybe since Steve has gotten the lung diagnosis back in, when was that, October? Even maybe before that, time just kind of all blends together. Now, we haven't given you a very thorough update. We've just kind of given you glimpses and pieces, and I think it's because we've been so in it that we have just kind of updated as we have had the energy or the time or the space for, or even the words for. So I'm feeling a little bit put together today so I can actually share a lump of it for y'all in one place so that it's not as all over the place. Maybe. So it's not all over the place. Maybe, right? So since Steve has gotten told about the lung, we have had a lot of questions asking, what made Steve's lung get to the point where he is, and also we get a lot of questions about why is Steve still in the bed full time, why doesn't he get up in the wheelchair? There's plenty of people who are as advanced with ALS and still get up. So I want to go back a little bit. In about 2017, Steve got a wound. He got it while he was in the ER. It was one of those wounds that started from the inside and worked its way out. He was on a gurney for about 6 or 7 hours. We shifted him a little bit, but when you're on IV food as your primary food, skin integrity just only goes so far. So he got a wound. It was about a stage 2, if I'm remembering correctly. A few months after that, we were back in the hospital and he was transferred to a metal table to get a procedure done. I think it was a speeding tube or a PICC line. And he felt it happen when they transferred him to the table. It opened the whole way to his bone, so it became stage 4. Where the wound was on his left sit bone. And so to get up in the wheelchair was very painful, and it would stop the wound from healing. We would try it, and then it would reopen. We would just keep losing progress, and he would be in too much pain. It just wasn't worth it for him. The risks didn't outweigh the benefit, or the benefits didn't outweigh the risk, whatever the thing is, you know what I'm trying to say. So, because of this wound, and knowing how to treat a wound is to be off of it, he was in the bed, we were turning him. We were turning him off his left to his right side, which Steve had a lung collapse when he was 67 pounds back in 2014. Maybe this was even 2013. He was in the hospital. They were putting a central line in and his lung collapsed. They put a chest tube in. It was his right lung, and it healed. But, the damage kind of was done there. Steve also got a diaphragm pacemaker put in when he was first diagnosed, which is right here. And it's just an unknown. Could that have played a role in the lung being compromised? Could be. Don't really know. So a combination of those two plus a lung infection that was pretty persistent then, before he was even totally taken over by it, being turned off his left butt to his right side, before we knew it, collapsed his entire right lung. The entire one, not just a lobe, the entire right side of his lung is collapsed. And that's how that happened. Also, from being turned off the left, he got a little baby wound on his right side, sit bone as well. And that's why no longer do we do turns. Steve's floating. I have a pillow in front of his butt and a pillow below, or behind his butt, and he's floating as much as he can be, because turning doesn't do anything for him, and both wounds actually are currently open. So, in terms of the lung, when we went into the hospital at the beginning of February, Steve was desatting even while on the vent and on oxygen. They gave him 10 liters. They did a bronch. They got a ton of stuff out, and then he sort of stabilized from there. And in terms of the lung now, is we've been turning him almost daily. Today he gets a day off. Are you excited for a day off? I'm excited for a day off too. And every time we turn, I do cupping, which if you don't know, you do this. You just kind of get on the back, and it works so well in moving junk out of the lungs. In fact, last week when we did it, it was like I gave Steve a mini bronc. His dad, thankfully, was wearing a gown, but, you know, was holding him, and I was just dumping buckets of stuff out of Steve's lung. I just kept taking the vent off so it would pour out. That's what cupping does. It will get whatever's at the base up and out. And that has helped his lungs significantly, us doing it almost daily. We were doing it, but he was only turning 3 days a week, sometimes even 2, but more so 3. And it was mostly because Steve doesn't like to turn. And it wasn't necessarily one of those things where we felt like it was an absolute must-do, like it is now. Now, how are his kidneys, you may ask? So his kidney labs have returned back to his baseline, which is great. However, what does that mean? We really don't know. So with this whole hemoglobin thing, the fact that Steve has needed another blood transfusion, even while being home, not on antibiotics, was suggested that maybe it is his kidneys still are kind of in a stage of failing. It's been one of those things where different doctors that we talk to have different understandings of what's actually going on with Steve, and it's kind of a frustrating thing. And it is frustrating. I know there's people within any kind of illness, once you get further in and the complications kind of start stacking up, it's hard to tell what's causing what. And the thing is with Steve, he's needed blood transfusions for probably 3 years now. Yeah. And he was diagnosed with anemia of chronic diseases. And again, when you have gastroparesis, meaning whatever's put into your stomach you vomit up, it means you're not absorbing things that's put into your stomach. And when you have absorption problems, it means you also have a hard time making hemoglobin. And then there are things that suppress hemoglobin, like antibiotics, illness, chronic disease, etc., inflammation. And then Steve has these 2 wounds that have recently opened that, you know, we've been turning him every day treating, and they do bleed, and they are healing. They're healing very well. Good job, babe. And so our hope is that the only reason his hemoglobin was low was because of that and not the kidneys. But do we know? No, we have no idea. We are in a constant state of not knowing. I am pleased with Steve's urine output. I have been saying they changed Steve's TPN drastically when he got the whole kidney problem. So let me tell you guys what actually happened. Steve went into the hospital because his feeding tube was bleeding. And his feeding tube was bleeding because ever since Steve got his feeding tube, it has leaked stomach acid, it has leaked all kinds of things around. He has gotten upgrades, you know, in terms of size of the tube to the largest one. It's the same that's happened with his trach. So, you know, skin integrity, again, it's just not great. That that erosion leaking around the feeding tube has slowly made an actual, so here's the tube, and there's a hole around there because the skin has just been eaten away by acid. Every wound care, every kind of doctor, every nurse, everybody has been consulted to look at this feeding tube because it has been a problem from day one. And we have tried billions of things, and some work, some don't. Basically what it comes down to is Steve has spasms still, and when he breathes, you'll see his tube will move. So you have to kind of pack it, make sure it doesn't move, because the moving was just causing trauma. Well, because Steve had just been in the hospital, not even 4 days prior to this bleed, he was getting Lovenox shots, which is a blood thinner, right in his belly, right by his feeding tube. And that is why he was bleeding out so significantly. We did not know that. So we did a CT scan. The doctors wanted to do a CT scan. I say we. I feel like I'm part of the team. They let me feel that way. They did a CT scan to see if he had any internal bleeding. And the amount that Steve was bleeding, we were all, I mean, he wasn't even awake because he bled that much. When I say he woke up in a puddle of blood, I'm not exaggerating. People who came to help clean the house afterwards were like, it looked like a crime scene because there was blood everywhere. He just wouldn't stop bleeding. The CT scan has this contrast, which if you've ever had a scan, you know you have this sign because the contrast is really not great for you. It's a risk. Steve's had the contrast, hey girl, probably 10, 15 times at this point. He's had CT scans, he's had it when he's got his PICC line done. This isn't the first time he's had it. He's never had a problem. But being on antibiotics for so long, off and on, really strong ones, And the state of his kidneys as it is, where his pills are, TPN, everything, this time the contrast gave him an acute kidney injury, is what it's considered. And that is what it was. That's what set his kidneys into kidney failure. So once we figured that out, we knew, took a long time to figure out, we knew that he would bounce back. And he did. About a month later, his labs got back to the same. But is the damage done? And, do we still have to treat the kidneys like babies? We don't know. And that is why the TPN has become a very complicated situation right now. They drastically changed the formula, and they haven't gotten it to the point where he is being nourished as well as he needs to. His electrolytes are crazy. His carbon dioxide was really, really high. Thankfully, he's already on a vent. His hemoglobin keeps dropping. We don't know what that's about. So there is going to be weeks where we are trying to get him on the right food formula. I was giving Steve half of the time juice and half of the time tea. The teas that I give him are fine. They have no contraindications on the kidney. Once his kidneys got super compromised, I consulted an herbalist who has been an herbalist for 15 plus years, just to make sure, because I haven't dealt with this type of fragility before. And he said, no, everything you're doing is great, keep doing it. He suggested a few other things. Well, as it comes to turn out, obviously Steve is not absorbing any of the juice, because if he had been, his hemoglobin wouldn't have dropped from 8 to 6.9. So we're going back to just teas. I did get some more of that Pure Absorb iron stuff. They come in a little packet. We used to use it years ago. I'm not a fan of how it makes him feel, right? So we're gonna see if it helps. I will be able to give him nausea medicine and give it to him every day, just to keep him out of the hospital and keep him from getting blood transfusions. But we will see. We're in a very big state of wait and see how this plays out. But I will say, while Steve has little energy, he is able to use Toby now. When we first got home, he couldn't even use the Toby. He couldn't get to his remote control, which he can now. He couldn't type anything except for a bunch of letters, gibberish. So he is at least typing things here and there. His energy is slowly improving. In terms of urine output, I think the volume is great, but I still think he's dry, or he has UTI. Not really sure. The urine isn't pretty. It's amber. And amber should be the color of his energy, not urine, right? So we still have a ways to go. I think we kind of always are going to be working against a lot of things, and we're used to it, and even though we're tired, we're still in it, 100%, right? In it. So that is where we stand. Steve's lungs, as long as he is turned on a regular, clapped and suctioned, clapped. No, we don't want the clap. Cupped. Cupped, suctioned regularly. It's sustainable. He can be okay with it in terms, as long as, we keep an eye on plugs and things like that. The kidneys, I don't know. We don't know. I mean, even our team doesn't really know at this point. So it's still a wait and see. And we will celebrate what good is happening while also being very realistic about what possibilities there still lie. We don't know. Is he 100% out of the woods? We have no idea. So, yeah, did I sum it up, or am I missing something? I see you trying to type. Did I miss anything? I summed it up. Ultimately, Steve, I'm going to ask you some yes and no questions so you can answer some. Is that okay? Okay. One blink is yes, and if you have a hard time seeing his eyes, I will let you know. I think they can see your eyes. Do you feel better than you did when you were in the hospital? You're saying no? You're saying yes? You do feel better since when you were in the hospital. Okay. Do you feel like you still have room for improvement? Are you happy? Are you sleeping a lot? Sleeping a lot. But you've been awake more. I forgot to talk about the blood pressure thing. He developed high blood pressure Obviously, that could also be a symptom of the kidney. It could also just be the fact that both Steve's parents have had high blood pressure for a long period in their life, and it could just be a hereditary thing, and it happened with Steve quicker than it would have without ALS. Who knows? It could be disease progression, it could be infection, it could be inflammation, it could be a lot of things, and that is why they stopped trying to find it when they realized it wasn't going to correct itself, and started to treat it because it was dangerous. And when I say dangerous, the highest one was 220 over 127. And if you know anything about blood pressure, that is like stroke level blood pressure. That's very dangerous. Now, he's still high. I mean, he still has high blood pressure, but it's more than normal. So it's 160s, he can get up to 180. The bottom number can get above 100, but it's not as bad as it was. And because he's on a beta blocker, it suppresses some of his energy and emotion, and he's tired. And he doesn't want to take more medicine. So we are going to accept his normal high because it's not dangerous high. And roll with it for as long as we can. Basically where we are is we are in full awareness of what the situation is. But we also know that Steve's body is capable of doing some serious healing. I'm telling y'all, it is incredible the way our bodies can heal from things. And if you are supported and encouraged, and you support it and encourage it, your body that is, it's incredible what you can do. Steve has proved to me time and time again that if you are 100% in, heart, mind, brain, soul, all of it, you can heal. And so I hope that is some sort of encouragement to everybody that even though Grr, are you grrring like a lion? Roaring? Is that what you're doing? That's really adorable. I love you. Okay. Anyways, just let that be an encouragement to you, because as down and out as you can possibly get, you can heal. And even though there is no cure or treatment for ALS yet, there are ways to heal from some of the setbacks that come with it. Alright, I think that's everything. I feel like all the updates have been bits and pieces. Now you have it in one small story, video, whatever. And we love you all. We really appreciate all your support. Honestly, without your financial support, your prayers, your love, just caring about us, people who come clean our house, people who send bandages when we're running out, you all are our lifelines. We could not do this without you at all whatsoever. I don't even know if I'll ever be able to express my gratitude enough. If you can donate blood, please do. I get a lot of questions about if you can specifically do so for Steve. Don't think that's how that works, ever. I think you can go any blood donating site and they'll pull from wherever they need it from. But yes, donating blood saves lives. If you're watching this and you know another family that is dealing with ALS and they're in it this complicated, reach out to them. There is something that they could use your help with, and sometimes they just need you to ask, what can I do to help? Because it's not fun to constantly need to ask for help. But you guys have led us, and you have been there with us this whole time, and we really, really appreciate it.